Rabeprazole sodium is a medication used to treat certain stomach and esophagus problems such as acid reflux and ulcers. It works by reducing the amount of acid produced by the stomach, which can help relieve symptoms like heartburn, difficulty swallowing, and cough. This medication also aids in healing acid damage to the stomach and esophagus, and can help prevent ulcers and possibly reduce the risk of esophageal cancer. Rabeprazole sodium belongs to a class of drugs called proton pump inhibitors, PPIs. It is typically taken once daily before a meal, and the dosage may vary depending on the condition being treated. It is important to take rabeprazole sodium at the same time each day for the best results. Before you start taking rabeprazole, make sure to read the medication guide and the patient information leaflet. If you have any questions, ask your doctor or pharmacist. If you are taking the tablets, take your dose by mouth with or without food as directed by your doctor, usually 1 to 2 times daily. Swallow the tablet whole with water. Do not crush, chew, or split the tablet. If you are using the capsules, take the dose 30 minutes before a meal as directed by your doctor, usually once daily. Do not swallow the capsule whole. Open the capsule and sprinkle the contents onto a small amount of soft food or liquid. Swallow the entire mixture within 15 minutes of preparing it. The dosage and length of treatment are based on your medical condition and response to treatment. In children, the dosage is also based on weight. If needed, antacids may be taken along with this medication. If you are also taking sucralfate, take rabeprazole at least 30 minutes before sucralfate. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Continue to take this medication for the prescribed length of treatment even if you are feeling better. Tell your doctor if your condition lasts or gets worse. The risk of side effects goes up over time. Ask your doctor how long you should take this medication. If you experience a headache while taking rabeprazole sodium, it's important to let your doctor or pharmacist know. This medication has been prescribed to you because the benefit is greater than the risk of potential side effects. However, it's important to be aware of any serious side effects that may occur, such as symptoms of low magnesium blood level, signs of lupus, or severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as diarrhea that doesn't stop, abdominal pain, or blood/mucus in your stool, it's important to notify your doctor immediately. It's also important to avoid using anti-diarrhea or opioid products if you experience these symptoms, as they may make them worse. In rare cases, proton pump inhibitors like rabeprazole can cause vitamin B12 deficiency, especially if taken for a long time. If you notice symptoms of vitamin B12 deficiency, such as weakness or numbness/tingling of the hands/feet, be sure to inform your doctor. While it's rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as fever, rash, or difficulty breathing. And remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Before taking rabeprazole, make sure to inform your doctor if you have any allergies to this medication or similar drugs. It's also important to discuss your medical history, especially if you have liver disease or lupus. If you experience symptoms such as heartburn accompanied by lightheadedness, sweating, dizziness, or chest, jaw, arm, or shoulder pain, seek medical help immediately. Additionally, if you notice unexplained weight loss, it's important to speak to your doctor. If you are scheduled for surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that long-term use of proton pump inhibitors like rabeprazole may increase the risk of bone fractures, especially in older adults. Speak to your doctor about ways to prevent bone loss and fractures, such as taking calcium and vitamin D supplements. For older adults, there may be an increased sensitivity to the side effects of this medication, including bone loss and C. difficile infection. Make sure to discuss any concerns with your doctor. If you are pregnant, rabeprazole should only be used when necessary, so be sure to discuss the risks and benefits with your doctor. Additionally, it is unclear if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with rabeprazole sodium, as they can change how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with rabeprazole sodium is methotrexate, especially high-dose treatment. Some products need stomach acid to be properly absorbed by the body, and since rabeprazole decreases stomach acid, it may change how well these products work. This includes medications such as ampicillin, atazanavir, erlotinib, and others. Additionally, this medication may interfere with certain lab tests, which could result in false test results. It's important to inform lab personnel and all your doctors that you are using this drug. Always follow your doctor's recommendations and discuss any concerns about potential interactions with them. If you suspect an overdose or experience serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember, it is important not to share this medication with others. If your doctor has prescribed this medication for long-term use, you may need to undergo certain medical tests such as magnesium blood test and checking your vitamin B12 levels. It is important to attend all your medical and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose of rabeprazole sodium, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take your next dose at the regular time. Don't take a double dose to make up for the missed one. Remember to store rabeprazole sodium at room temperature, away from light and moisture. It's important to keep it in a safe place away from children and pets. When it's time to dispose of this medication, make sure to do so properly by consulting your pharmacist or local waste disposal company. Never flush it down the toilet or pour it into a drain unless instructed to do so. And remember to discard it when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.